Which of the following statement relating to the chronic inflammation is true? We know there are two important type of the inflammation. One of them is the chronic inflammation, another one is the acute inflammation. We have to find out that which is true regarding the chronic inflammation. Here are the options. Options are: chronic inflammation is mainly secondary to acute inflammation. Neutrophil are predominant cell involved. Growth factor are not involved in this process. Appendicitis is the mainly a form of chronic inflammation. Fibrosis is a macroscopic feature. So, first of all, we have to know details about the chronic inflammation. So, the right side, it is the chronic inflammation part. In case of the chronic inflammation, first of all, here we can see the angiogenesis predominant. That means chronic inflammation when the inflammation persists more than 6 weeks, or sometimes it may call the more than 3 months. So when a inflammation which crosses the 6 weeks, it is known as the chronic inflammation. That means the longer time inflammation present. So when there is the longer time inflammation present, in there different type of the change occur. First of all, here we can see the angiogenesis. What is angiogenesis? Angiogenesis is the formation of the new vessel. So when there is formation of the new vessel, it is known as the angiogenesis. And the chronic inflammatory cell. The chronic inflammatory cell are mainly lymphocyte, macrophage and plasma cell. So what are the chronic inflammatory cell? It is very, very important for any type of the exam that the chronic inflammatory cell, they are the lymphocyte, macrophage and plasma cell. And they are healed by the fibrosis. So in case of the chronic inflammation, there are different type of growth factor release. There is the proliferation of the different cell, including fibroblasts. There is release of the collagen, and finally there is contraction of the collagen and develop fibrosis. But in case of acute inflammation, here we can see the change existing vascular structure and increased permeability of the endothelial cell and the infiltration by the neutrophil cell. So the predominant cell for acute inflammation is the neutrophil. And what are the process involved? It involves suppression, complete resolution, abscess formation, progression to chronic inflammation and healing by fibrosis when it goes for the chronic inflammation. So the fibrosis is not feature of the acute inflammation. When the acute inflammation goes for chronic inflammation, this chronic inflammation leads to fibrosis. And what are the macroscopic feature of the chronic inflammation? So what is the macroscopic feature of the chronic inflammation? It includes ulcer, it includes fibrosis, and it also granulomatous process. So ulcer, fibrosis and granulomatous changes, they are the macroscopic feature of the chronic inflammation. And in most commonly occurs as a primary event rather than as a result of the acute inflammation. That means there is the repeated attack may occurs and finally develop chronic inflammation. So acute versus chronic inflammation, here again see the acute and chronic. The chronic inflammation, it persists acute inflammation due to non-degradable pathogens, persistent foreign bodies and autoimmune reaction. That means the chronic inflammation, it starts as a acute inflammation, but when acute inflammation persists more than 6 weeks, it is known as the chronic inflammation. A cell involved monocyte, macrophage, lymphocyte, plasma and fibroblast, and it is delayed, that means more than 6 weeks, and it may require months or years, and finally there is tissue destruction and fibrosis. So which is true regarding the chronic inflammation? So which is true? The chronic inflammation is mainly secondary to the acute inflammation. It is true. Neutrophil are predominant, or it is false. The chronic inflammation is mainly secondary to acute inflammation. Then neutrophil are predominant cell. We know the not neutrophil. It is the lymphocyte, macrophage and plasma cell. Growth factor are not usually involved in this process. It is also false. The appendicitis is mainly a form of the chronic inflammation. It is not true, because the appendicitis, it is the acute inflammation or recurrent acute inflammation of the appendix, because in case of appendicitis, inflammation develop, completely resolved, that means acute inflammation closed, and again starts, that means again starts acute inflammation. Fibrosis is the macroscopic feature, it is also true. And chronic inflammation is mainly secondary to acute inflammation. It is not true, it is the false, because chronic inflammation usually primary to acute inflammation. That means the acute inflammation develop, then chronic inflammation, when acute inflammation fail to recover.